Welcome back to Metabolic Mind. I'm your host, Dr. Bret Scher. Metabolic Mind is a nonprofit initiative, a Bazooki group where we focus on the intersection of metabolic health and mental health and metabolic therapies like ketogenic therapies as treatment for mental illness. Today, I had the pleasure of catching up with Beth Zupec-Kania at the 8th Global Symposium on Ketogenic Therapies. Now, if you've seen some of our prior videos, you've probably seen Beth. She is a wonderful dietitian who has been involved in use of ketogenic therapy for decades. First in epilepsy, and still in epilepsy, but now also in the field of psychiatry and mental illness and mental health. And so Beth has sort of seen this whole transformation within the field of ketogenic therapies. And she's been involved in the International Neurologic Ketogenic Society and on these global symposiums for ketogenic therapy. She's been involved with these meetings for years and decades. So it's really interesting to get her perspective on how things have progressed, how things have changed, but where we still need to go to really help make ketogenic therapies more of a mainstream treatment. But now remember, our channel is for informational purposes only. We're not providing any group or individual medical or healthcare advice or providing a doctor-patient relationship here. Changing your medications or your lifestyles to treat medical conditions can certainly be dangerous. So please use our channel for information to bring to your healthcare team to see if ketogenic therapies or other metabolic therapies could be appropriate for you. So now with that, though, I hope you enjoyed this interview with Beth Zupec-Kania, who you can find at bethzupec-kania.com, but also ketomastery.pro, where they have their ketogenic training courses where dietitians can get continuing education courses. And now they're developing a specific one for psychiatry, which at the time of this recording, you can pre-order. So definitely check that out. All right, here's the interview with Beth Zupec-Kania. Well, Beth, thank you so much for joining me here today at the 8th Global Symposium on Ketogenic Therapeutics.
Thank you.
Now, it's kind of exciting to say actually not even the 8th annual because they had to skip a couple, but the 8th time that this group has met as part of the International Neurological Ketogenic Society. And one thing I've noticed by walking around here is just the number of accents that you hear, because it truly is international. Now, you've been involved in this whole field of ketogenic therapeutics and in these meetings for decades now. So I'm curious to just get your feeling of being here at this conference and kind of how you've seen this field grow over your time.
It's been so exciting to see it grow. We started off our first meeting in 2008 focusing just on epilepsy, pediatric and adult epilepsy, because at that time, that's what the ketogenic diet was known for. It was discovered in 1921. Lots of prospective studies, no randomized controlled trial until actually that year. But there were a lot of rogue health professionals that came together that said, we need each other because our colleagues don't understand this and we're working in silos, trying to get patients better, and we need to connect with researchers and other health professionals to, get some kind of support to be better able to get this to the people that need it. So that was our first meeting. And then it just kind of built from there. And the Charlie Foundation, who I do a lot of consulting work for, was actually the organizer of the first few meetings. And then we started to share that responsibility with Matthew's friends in the UK. So we alternated the responsibility of these meetings, and then the meetings just got to be too big. And Jung Rowe, who has been a part of every single meeting from the get-go, came up with a brilliant idea to start a society now known as INKS, the International Neurological Ketogenic Society. And one of the responsibilities of the society is to take over the organizing of the meetings.
Yeah, I can imagine at that first meetings when there weren't that many randomized controlled trials, there weren't that many institutions doing this, you probably felt like a bunch of kind of rogue dietitians and doctors coming together, but it must have been so nice to know that there are others doing this, trying to help patients in that way. So to go from there to where we are now with hundreds of people here, with dozens of randomized controlled trials, but now no longer just focused on epilepsy. Now it's, the name of the conference is Ketogenic Therapies. The name of the institution is Neurologic Ketogenic, right? So it's the brain in general. So how have you seen that really sort of change to a broader intervention for ketogenic therapies?
Yeah, so at probably the second meeting, we started discussing all of the other conditions that we could see improving on a ketogenic therapy. It wasn't just epilepsy. Children with epilepsy have depression as well as adults. People with multiple sclerosis have epilepsy. People with diabetes have epilepsy. So we started realizing that these other conditions are improving and that we really had to address those as well. So that started a whole new trajectory, brought in new people to the meeting, triggered research, and most importantly, got us going on writing some consensus guidelines as a group. So a lot of the professional speakers at these groups worked together to come up with guidelines, first for epilepsy for children, then epilepsy for adults, GLUT1 disorder. Now migraine headache has a consensus guideline, and that's all stemmed from these meetings.
Yeah. Did you ever think it would grow this much from that very beginning?
I guess I wasn't thinking ahead. I was kind of thinking of me, centrally, how I could get through another patient without, having to reach out to somebody, or how I could assist others from what I learned. Because with each patient, you just learn so much, and it's not something you get from a textbook. You really, you're really pioneering, really, and then being able to brain trust guidelines to help people is just, I think, like the ultimate output that we can share coming together.
And that's so important to have those guidelines, because like you're saying, this isn't something you learn from a textbook, and it's not something dietitians are really learning in their training. And so that's another part of your passions, I know, like to help people learn about this. So when you have a tool that can be so impactful and it's not being taught in the training programs, how do you approach that? How are you trying to combat that?
Yes. So years ago, I think I'm really dating myself here. 2005 is when I started going out to hospitals and training centers, and it was mostly the major academic centers. And I really didn't have to advertise because people were contacting me for support. Mrs. Kelly had retired by then, so she wasn't available. And I was probably her protege, because I was contacting her constantly for support. So she was referring people to me, and I just started going out and training and going to epilepsy meetings and setting up shop for the Charlie Foundation and promoting, the trainings. And I've done over 200. Denise Potter finally joined me because I talked her into helping me out, because I just couldn't keep up with all the traveling. In those days, we were going into hospitals. Now, since COVID, we can't do that for good reason. So we've gone virtual, which is, very common way to educate people around the world. And we have this course called Keto Mastery Therapeutics, and we have a foundational course and an advanced level course. And then we have, they're recorded. Dietitians can get credit for these. And then we have a live quarterly Q&A, and anybody that's taken our course can join. And it's just, it's worked out really well. We've actually been able to reach more people than we did when we traveled to centers, because we can teach whole teams. And now we're working on a psychiatry focused session that's going to be launched soon.
Yeah, we're really excited about that. And I think it's so necessary, because if someone says, oh, well, you can use keto for epilepsy, but what does that mean for me in the psychiatry realm? Like, you may not be able to connect the dots, but to have that focused training and to have the live Q&A, I also think is so crucial. So, it's not just you take your course and you're done, but it's actually an ongoing learning as this whole field evolves. Mm-hmm. And so, how do you see it starting to expand into mental health and mental illness? And I guess to add on to that question, a psychiatrist isn't likely going to want to learn how to start someone on a keto diet, tell someone how to make meals and how to shop. So tell us about sort of like the team approach that will be necessary to build this in the psychiatric community.
So I think of all the other brain conditions, using epilepsy as the prototype, and neurologists don't have time to sit down with families and teach them about diet, nor do they really have the background to do that. And the same is true for psychiatry, although I will have to say the psychiatrists are taking more of a leadership role in this, because a lot of them have put themselves on a low carb or ketogenic diet, and they themselves see the benefit. And so it's not that hard for them to talk to their patients about it, to get them on board with, listen, I'm doing this. I may have some depression issues myself, and I can help you get going on it. But here's where we come in. It's like, I've got a nutritionist that I can refer you to for, the really get down and get dirty, what do I eat? And how do I avoid the possible complications that may be a concern and are completely avoidable, such as constipation or kidney stones. These are things that you'll read about that are kind of scary, but are typically very avoidable if you can take some prevention steps.
Yeah, and that's where someone with the expertise like you or Denise or the team that you're building and training can be so important, because it doesn't have to be difficult. It doesn't have to be, people think it can be extreme or it can be really challenging, but it really doesn't have to be if you know what you're doing and if you have the right guidance.
Right, and there are multiple different ketogenic diets that we use for epilepsy. They're well published, they're well defined, and people come to us kind of confused, and oftentimes they put themselves on a ketogenic therapy. And what we try to do is start them at a place that's comfortable, that fits their current kind of culture of food and their ability to either cook or not cook, or get prepared foods in advance, work with that, and then get them gradually into ketosis once they've kind of cleaned up their diet. And then, we might not have to get super strict. Some people are more willing to follow structured diet guidelines. Some want to kind of be very, very flexible. So we just kind of think of a starting place, and then we can manage and change this over time to get you to your goal, whether it's a certain degree of ketosis, and we're learning more and more about, degree of ketosis that we think might be more effective, or getting them through a difficult point in their life where they just need the stronger ketosis for a while, and then they can kind of back off. So it's the individualization of a ketogenic therapy, I think, is very key to keeping somebody on it for the period of time that they need it. And not everybody needs to be on it forever.
Yeah,
right?
I think those are such good points that for some people, a ketone blood level of 0.5 might be very different than a level of 2.0. And at what point in time do you need those different levels? And that's where it really helps to have expertise of someone to work with. So if someone wanted to learn more about your training course, or learn more about working with you or Denise or others, where would you direct them to go?
So ketomastery.pro is our training course. charliefoundation.org has a resource link that lists myself as well as other very experienced keto dietitians. Most of them have epilepsy backgrounds, and so their contact information is on that webpage.
Great. Well, thank you so much for joining us, and congratulations as well, since you're being honored at the conference this week, and deservedly so for your service and your involvement for so many years. So thank you.
Thank you.